Good afternoon, everybody. It's really good to see you. It's a unique setting to be talking. I do training of our staff all the time, and so I'm used to talking in front of people, and in this setting, I suddenly feel nervous. So it's good to see everyone. I'm glad you came to talk about this important topic. This is something I talk about day in, day out with our clients, and I'll give you a little background. And I am so grateful for the opportunity to talk to people in the dental health, oral health space, because most of my conversations are happening with the folks receiving services from MHR and with our staff and other people in the mental health universe. So it's really nice to have an audience of people in the oral health sphere of things. So my name is Jourdan Hennick. I have been at Mental Health Resources since 2016. I said that in a training yesterday to some of our new staff, and one of the new staff members said, I was in 8th grade. And I was like, oh my goodness, time isn't real. That kind of threw me, but gave me some perspective of how long Mental Health Resources has been doing this work at our organization. In 5th grade, I fell on the doghill gym and I bumped my front 2 teeth out, and I was voted then as a 10-year-old most likely to become a dentist. I don't have any of those skills to be a dentist, but I feel like this is like living out my calling of addressing dental needs for the folks served by MHR. That's kind of how this landed me here. I have my master's in public health that I finished a couple years ago. And my project, for my final project for my MPH, was to create a toolkit, and it's called Dental Care for People Living with Serious Mental Illness and/or Substance Use Disorder. And that has come out of the work that we've done through our dental initiative at MHR. MHR is a community-based mental health organization. We provide targeted case management and assertive community treatment services in the metro area primarily. We also have substance use disorder services, therapy services. We do care coordination and up in St. Louis County. So we serve a very large population of people for targeted case management and assertive community treatment. Those folks are people who live with serious and persistent mental illness. And there's a category of what that all entails. But we're going to go through some of what those diagnoses are and what that looks like. Not necessarily the ins and outs of diagnostic criteria, but more importantly, what that might look like in a dental setting, or what that might look like for folks in a home setting, and how that better to help you all, to help folks understand this is what you might be seeing, and here's things that might be helpful. That are just a little bit different, or maybe already in line with what you're doing. MHR has been around for it'll be 50 years next year, and we started this health and wellness work back in 2015, and it has been really awesome to see our MHR be able to continue to support this work. Folks living with mental illness, so people with a serious and persistent mental illness, die 10 to 25 years earlier than the general population. And when I say that statistic, oftentimes people are just they're kind of that makes sense. They often link it in their minds to mental health symptoms, or to substance use, or to suicide, or something like that. But the vast majority of that early death and disease is from preventable and treatable conditions. And so we know that to be true, and we have to, as an organization, knowing that is happening in our population, and it's continuing to happen, we are committed to addressing those health needs. And that disparity, that research came out in 2006, and it's across the US, and the numbers have held in the 20 or so years since that study came out. We do, in addition to our dental work, we also work a ton on tobacco. Tobacco being one of those number one reasons, one of those number one causes for those preventable, treatable illnesses. And then dental is something that We know that there's disparities in folks who have MA accessing dental care versus folks on commercial insurances across Minnesota. So we know there's those big gaps just in accessing the care. And then you all could probably tell me more about the gaps of the needs, like when someone comes and sits in your chair who hasn't been for a long time, or is on MA and has never been to the dentist or whatever, that you know that there's disparities in folks' needs. So we address at MHR dental health through a grant that we get through the from the Delta Dental Minnesota Foundation, and it allows us to do a couple of things. We do a lot of training of our staff on how to have conversations about health topics, including dental. We don't want our staff to think that they have to be, a dental professional to be able to have conversations about oral health. We want to empower them to bring that up and empower them to know that you can help make those connections to help people get the care that they need. Oftentimes, there's a lot of shame that folks feel around their teeth. If they haven't been to the dentist for a really long time, there's this sense, and I've heard this from a number of clients, that there's this sense of like, I did this to myself, I don't deserve good care, especially if folks have a history of substance use disorder and there's something that's, they're having trouble with their oral health as a result of that. They feel a lot of shame. And so our case managers are hearing these things. They're hearing these conversations, they're talking to folks, and we want our staff to know, here's how we can help those individuals get the care they need, and you can be supportive of that and supporting them, and you don't have to be a dentist to be able to do that. We also, through this grant, we have some incentives. It's a $25 gift card for our clients. It's not a lot of money, but we handed out like 120 of them this year. I think it might be more than that. And it can make the difference. $25 is the thing that gets folks to go, then like, awesome. We have people who said, like, you can give me a $500 gift card and I'm still not going to the dentist, but we do that. And we have a small pool of money to help pay for stuff for folks who are uninsured or underinsured, and also for people for stuff that isn't covered by MA, or like scaling and reclaiming is now covered, which is amazing. A lot of our folks need that, but sometimes the prior authorization doesn't go through, but the dentist still says we need this. So that's where our dental funds, where that pool of money goes, is to help with those really fundamental things. So we're just going to talk about the barriers that are faced by folks living with SPMI, and SPMI is the abbreviation for serious and persistent mental illness. And then also talk about some of the ways that clinics can make completing that care easier for those individuals. So I don't have to tell you this, but the importance of dental care, these are kind of the focus areas when we're talking to our clients, to the folks that we serve, about why should I even go to the dentist? My teeth don't hurt, I'm not that interested, I had a terrible experience, it's gonna be expensive. We have conversations around these sorts of areas as a starting point. So we connect as often as possible. Like, the mouth is your whole body. We care about you, not just your mental health. We care about your physical health, your oral health, all of that. And connecting that to, if you have a toothache, it's really hard to do anything. It's hard to eat, sleep, anything. Then just preventing tooth loss and gum disease. And we talk a lot of our folks have other chronic conditions in addition to their mental illness, and connecting that as often as possible, that by managing oral health, things can go better, can be improved on for the other things that you're living with too, like diabetes, for example. And a ton of conversations. We talk all the time about that prevention of pain and infection. Waiting to go to the dentist until you're in pain is not great because you're in pain. So if we can prevent that from happening in the first place, that would be ideal. And also, we get a lot of calls for help and support on Fridays at like 3 p.m. Like, I have a pain in my tooth that hurts, and there's no dental emergency room, and a lot of clinics close earlier on Fridays, and so we're kind of helping people scramble through that, and that's okay. We will do that, but we want folks to have established care with a clinic that they can call before they're at that excruciating pain. Like, oh no, it's the weekend. Like, what am I going to do to make it through an appointment? So mental illness can impact our oral health, and oral health impacts mental illness, right? It goes back and forth. And in the toolkit that I wrote, part of what I did was I didn't want to overwhelm folks in the dental world of like diagnostic concerns. Here's the thing, here's what it means to have a schizophrenia diagnosis. The focus is mostly on here's how this shows up for people in their oral health. So I'm just going to kind of go through these, and my best way of understanding them and knowing them is to talk about some stories and some individuals that I have seen over the course of working at MHR. So anxiety is a huge one we get all the time. We work with one individual who she had anxiety about her teeth. She wanted to get the work completed. She wanted to do the appointments, and she would get more and more anxious the further out those appointments got. But getting into once she got to the clinic, she had a really hard time being able to complete the appointment. It was like those two anxieties just kind of built each other up. And her case manager worked with her and her prescriber for her psychiatric medications to get a PRN so that she could go to those appointments, to have that, to be able to complete those. And that helped her to really reduce the anxiety about not completing the appointments, and then made those appointments possible. And she has worked she's come in and out of being a part of this dental initiative. I've seen her name in and out over the last several years. So I know that she's working on that with her case manager, and it's kind of a partnership then with the prescriber as well. That case manager was creative in saying what can we do other than have you go to a clinic or go to an appointment at the dentist and then you just get up and leave and can't finish that out. Depression, we have all heard of depression. Major depression can make it so hard for people to do anything. And a lot of folks have maybe experienced a minor depression or a sadness, but major depression can make it hard to even get out of bed to go to the bathroom. People end up really, really sick. They're not eating, not drinking, not motivated to do anything. One individual I worked with, she had really severe depression to the point that she wasn't really eating. She for sure was not brushing her teeth. And she was just in a really, really rough spot. She needed extractions, and she had Medicare only. So she did not have dental insurance to cover the extractions she needed or the dentures. And we worked together to find a clinic that the dental best practice funds that we have at MHR could help pay for things. And then what happened on the dental end that was so awesome was all of the staff at this clinic, they were so happy to see her every time she came in. So she would make it to an appointment, and the staff would, they're busy people seeing lots and lots of patients, but there was something about her walking into those appointments, seeing her provider, and that provider being happy to see her, that made those appointments way easier for her to complete. And it was hard to get extractions. She was really ambivalent about it because she didn't want to lose her teeth. Even though they were in really rough shape, she wasn't sure about that, but because she had such positive interactions with her providers at the dental clinic, it made it easier for her to trust that the things that were going to happen next were going to be a benefit to her. So long story long, she got all of her extractions, she got dentures, and I didn't see her for a couple months. She continued on with her life and was working on other things. And I got a letter in the mail from her not long after that. And it just said, she was saying thank you for helping with all of this stuff. And she said, getting dentures saved my life. It's huge. That bit of humanity and connection that she was receiving from the staff at the clinic enabled her to be able to do the thing that was maybe really just weighing on her, in addition to this serious depression that was making everything more difficult for her. And so I know that I don't work in a dental clinic. I don't know all the ins and outs of that, but what I do know is that dental providers care deeply for their patients, for the people that they see. And I do know that the impact of the work that you're doing and what you bring to those appointments and what you bring to people can truly be life-changing. I got the card in the mail because I was the coordinator for this, but like, if I could, I would have sent that card right along to all of the dentists and the assistants and the receptionists, all the folks at that clinic that made it possible for her to be able to do that. Bipolar disorder it's like depression plus mania. I don't really have a specific story for this, but something that can happen with when folks are in a manic or experiencing mania, the things that they do can be really risky. So sometimes this is where folks might have that sense of like, oh no, I did this to myself. Like while I was experiencing mania, I did something really dangerous and I damaged a tooth, or I was using whatever substance more than I normally do. And so a lot of times folks, when they come out of that manic state, can have that, and there's damage to their oral health that happens as a result. They have that sense of like I did this. And again, what we know is just bringing some humanity and kindness to folks can make a huge difference in that. Schizophrenia and related disorders. So schizophrenia is something that is kind of marked by a disconnection from reality, as well as psychosis. And in psychosis, there are people experience hallucinations, so that can be seeing, hearing, but also smelling or tasting any sense, things that are not actually there for other people to see, hear, or sense. And then delusions, fixed delusions are like beliefs that are not, that aren't real, but that person experiences them as real. And there's a lot of connection between delusions and things like aliens, religion, but also medical providers, including dentists. I've worked with a number of folks through the years who they will only go to the dentist if that dentist is willing to read this letter about how they don't actually have schizophrenia, that they, were implanted with something years ago, and so like they just need their dentist to know that. And it can sound sort of goofy sometimes, but when that's like the difference of that, it's like, okay, as the coordinator, like on my end, I'm not here to challenge that delusion, and like if we can safely help that person get through an appointment, like then let's do it. The dentist doesn't have to say like, yeah, I sign off and I agree to this. It just says, oh, okay, yep, I will read that letter. I will take that into understanding. A story that is related to schizophrenia is this person who I worked with for years. He had a lot of fixed delusions and hallucinations really associated with his oral health and with dentists in particular. So he received services, his team helped him trying to get an appointment. He would go and then he wouldn't go in, or he would cancel his ride over and over. It was just, he would get there and then he couldn't do it. And we wound up getting to a dental clinic that they were so amazing. This clinic and the experience with this individual is sort of what inspired this toolkit in knowing and watching the providers so skillfully work with this individual. So he would, I accompanied him to appointments, which was really, I love when I get to do that and get to just be a support person. And we went into an appointment and the hygienist was gonna do this cleaning, and she said to him, do you, tell me about your, home hygiene routine, or whatever that question is that gets asked, right? And he said, I only floss my teeth, I never brush. And she didn't miss a beat. She just said, oh, okay. There was no, you should be doing this, or don't you know? And she then asked some questions that were completely free of any judgment or shame. Like, do you have a toothbrush? Do you have toothpaste that you like? Do you have, kind of getting at that. And he answered, and she finished the cleaning and things went really well. She was really awesome every step of the way, explaining things. After the appointment, we were waiting for his ride, and I was just curious about this, flossing, but never brushing. And the flossing, he said he only did every once in a while. And I said, you know what, what's getting in the way of you brushing your teeth? Just out of curiosity. And he said, ever since the FBI started following me, I can't brush my teeth. So here's this person, like, there's a lot of stuff that happens with schizophrenia, like disorganized thinking too, like just being able to brush your teeth, but his delusion about the FBI and like his experience of his symptoms of his illness were directly connected to the dentist. That hygienist didn't know that. But her response was so kind and so measured and so accepting of exactly where he was that he went back. He continued to go to those appointments. He went to a few that I accompanied him with, and every staff person that we interacted with was the same level of just respect and kindness that he now has like gone on his own. He has started to, like, he doesn't need my help, he doesn't need his case manager's help, he's able to do that because he's built that trust with providers, this provider in the community, and he knows what to expect, and he knows that he's not going to be judged or shamed for his whatever is happening with his mental illness, but also just for his home hygiene or whatever else is happening. All right, substance use disorders. We kind of touched on that already. That the often hearing, and I don't know, maybe you hear this too, of people just like they do not want to go to an appointment. I'll admit, I'm a person who just didn't go to the dentist for a long time, and I was so scared because I didn't have dental insurance. I was really scared about what the dentist was going to say when I actually sat down in the chair for the first time in like 10 years. And I didn't have a substance use disorder to kind of amplify that anxiety and fear. And I kind of like get that same like sense, but like tenfold for our folks who have damage on their teeth that is directly related to their substance use. So I had one experience, well, I've had some bad dental experiences, but I had a really great experience with a provider who just, when I was at that point, like being really anxious that she's gonna judge me and like, she's gonna say I have to get all my teeth removed, like just all the worst, going down this horrible rabbit hole. And she just said, I'm so glad you're here. She's like, we want to see you. We're glad you made it here today. And it was just this like very small, very reassuring thing. And I think, sometimes we see, on someone's, in their treatment plan, but in their record, like, oh, they're experiencing these things, or this is what I'm gonna see when this person comes in. And oftentimes it doesn't need a whole lot of like preparation on your end, like what am I gonna do? But offering those small kindnesses can make those appointments just go so much more smoothly, or let that individual just kind of like have a deep breath, slow down, and to relax, and to be able to complete that appointment. The last two on here, neurodevelopmental disorders. So that's a really big umbrella for things like autism spectrum disorder and ADHD. We at MHR have recently, well, it's been a couple years now, but we have started doing children's case management. So we're seeing more of this, trying to help the youth receiving case management services find dental providers who work really well with neurodevelopmental disorders. Basically, a lot of it is not in the sensory needs side of things because the dental appointment is such a sensory overload sort of place. And we don't have, people want a list, like, who are the dentists who can do this? But something we talk about is that each individual is an individual. So if you can, work with this kid or their family of like, what are their needs? And then when you go to the dentist or when you schedule that appointment, take that information with you and ask, can we do X, Y, and Z? Is it okay if I bring my, headphones and sunglasses and, giant stuffy or whatever? What are the things that can make that easier? And some of it is just kind of work on that end of the individuals and their families, and then just and taking that to the dentist and letting them know, like, having that open communication is something we encourage all the time. Okay. I feel like I'm talking very fast. Is everyone good? Okay. So the folks that we serve at MHR, barriers to care, again, I don't have to tell you all this. You know this, you see this, you understand this every single day. This is what you're experiencing probably from the folks that walk in your door. MA covers a lot more now than it did even 10 years ago, which is amazing, which is so awesome. And finding a dentist who takes MA and doesn't have a 6-month wait list has just gotten hard over the last few years. It is so challenging, and it's just getting more challenging, and that is not anyone's fault in this room, but it is, you all know, it is so complex. And so a lot of what we're doing on our end with individuals who are wanting an appointment, they're ready to go, they've had that conversation with their case manager, and then they call and like, I don't have an appointment until April. We just say take it, but take the appointments, and then continue, we encourage case managers to continue to have that conversation. Because that motivation of going or not going, it comes and goes, and if you don't show that appointment, you might not ever be able to go to that dental clinic again, which on the dental side, like, there's reasons that those policies exist as well. So it can just be really, really difficult. First, to find that dentist who takes insurance, then finding an appointment with that dentist while you're still motivated to go, and things are kind of in line in the rest of your life to be able to do that. Transportation, mental health symptoms, stigma is a huge piece. That internalized stigma, I've mentioned it connected to substance use disorder, but it happens with any mental illness. There's so much stigma in our society, especially for serious, those mental illnesses that like have a psychosis component to them. Like, there's a lot of stigma in general, and kind of internalized stigma. And then competing priorities. There's so much that people are navigating. All of us, every one of us, we have so much going on, and something that we try to acknowledge every day when we're talking with our clients is like, or even when I'm training case managers, we'll do some sort of initiative, some sort of outreach, or hope to get X, Y, and Z folks into the dentist, and we always remind case managers that we know it will never be 100%. We know that number is, not everyone here is gonna go, and that's okay. We're still gonna ask them about it. We ask everybody. It's an equity issue. I don't get to decide who gets the conversation about dental or not. And if you don't have housing and you just got out of the hospital, and you need to find a new daycare for your kids, like, going to the dentist right then might not be on the table. But we keep that conversation as often, coming up as often as possible. So like I said, I'm not a dentist or a dental professional, but my understanding is, like, you might get a little bit of behavior change sort of learning when you're in dental school, or any of all of those other schools. And the flip side is, like, in social work and in the mental health sphere, we talk about behavior change all the time. And so when I created the toolkit for my master's project, I really focused around these kind of frameworks to take into, like, as a lens to take into helping folks be able to better navigate appointments. And it's person-centered care, trauma-informed care, and motivational interviewing. And I'll go back to that appointment with the individual who had some of those delusions connected to the FBI and dentistry. That hygienist who we saw, she was, like, exemplary, person-centered. Everything, all of the questions that she asked and the next steps were really guided by what his needs were, not by, like, the checklist of things that she had to do and get done, but she was able she put his care and his needs, which were unique and probably pretty different from her, the folks she saw before or after him. And she was able to really meet him where he was, and that was what enabled him to keep going. It's, kind of partnering and coming alongside patients and asking some of those questions to sort of, get to the heart of what people need. One individual I'm working with right now, she needs to find a new dentist, and she called to get a new appointment, and the person that she talked to walked through all of her concerns with her. And the client emailed me and she said, "Oh, I talked to the scheduler, the receptionist on the phone. I told her all these things, and then she recommended this dentist." And she sent me a link to the clinic's website with the dentist, and she said, "What do you think?" So it's really putting some of those, she is saying she called, and that person on the phone didn't just get her an appointment, but got her an appointment with someone who seemed like a good match for her. Like, she felt really taken care of in that moment, instead of like, okay, there's nothing wrong with like, here's your appointment for April 15th or whatever, but it made her at ease in a time that was kind of stressful of like having to find a new provider all of a sudden. Trauma-informed care, it's not needing to know like the trauma of people, like we don't need to know like any sort of details, but making a plan to help an individual to feel and stay safe in a clinic setting is really at the heart of that. Understanding that people have gone through things that can be activated, especially in a dental setting, especially in a chair when you're reclined. There's so much, and again, you all know this, but there's so much that can really activate a person in that setting. And some of it is just having to slow down and have a bit of a conversation. I've noticed this more myself when I've gone to the dentist, but telling the dentist, and we encourage our all of the folks that we serve to be able to communicate and tell the dentist, like I said, I hate the dentist. Like I cry through going to the dentist, and it's fine. And I tell the dentist every time, I'm like, I just need you to just continue going, and like I'll make a, I'll really let you know if I need you to stop, but like it's okay that I'm crying. It's just like how I'm managing the situation. And and I've had some really amazing dentists who are just like, okay, and then they'll still check on me because they're compassionate, caring people who are like, you are crying. Are you okay? But making that plan, and some people want to stop and they want to know every step along the way. And that's what, like, talking to your dentist about that, having that conversation. I encourage people to make appointments online when they can, and in those like other sections and question boxes, having a sense of what you need and putting that in there. Because it's really hard when you show up as a patient to remember like, oh yeah, like I have a lot of anxiety and here's what might happen. Having that on there already has meant that when I step into a clinic, that the people checking me in or the person who does the dental assistant, whoever is doing that stuff, they see it, it's on there, and they can check in about it. And that's just a really, it just can make it easier for folks to navigate that and to continue to feel that like safety in a setting that can be really, feel really unsafe. And the motivational interviewing is just like a conversation sort of framework around behavior change. There are a ton of acronyms with motivational interviewing, but one of the biggest things that has been helpful is it's the ORs. So asking open-ended questions, giving affirmations, reflections, summaries. But those open-ended questions really give space for people to be able to give more information. If the dental hygienist that I had mentioned before, if she said like, tell me about your home hygiene routine. That's an open-ended question. That allowed that individual to say, this is what happens. If she had said, do you brush your teeth? No. Do you floss your teeth? Sometimes. She might not have gotten that same sense of kind of the gravity of that for that individual, the power in those open-ended questions. It gives that individual more space. And then reflecting back, reflections are the other part of that, the ors that are, I think, really important in saying, reflecting and affirming kind of at the same time. So she said to him, like, oh, like you, like, let me get this right, you don't brush, but you do floss. Like, how often do you floss? And really building on that, affirming here's a good thing that's already happening. Like, let's continue to build on that and to provide support. It's a whole big old framework, and there are people who are so incredibly skilled at vocational interviewing, but there are pieces from it that are valuable to anyone in any helping profession, even if you're not like gonna go take all the classes to be an MI expert. And one is also the concept of like coming alongside someone. So really like having a conversation together, and it is kind of that person-centered thing too. Like, here we're gonna have this conversation together. We're gonna move towards this thing together. Like, what might that look like? And that there's a lot of opportunities for that person to really be at the center of their care and to have that dentist supporting them in that without like a very, firm or restrictive like treatment plan or way of having to do that. Okay. We talk a ton about anxiety. I made a handout years ago it was kind of complex, and then I really simplified it into this. We start with the things that are the easiest to things that like cost money. And the things we recommend to all of our folks is to consult and communicate with your dentist. Like, it seems really like, oh, of course I would do that. But when you're scared or you're anxious or you're activated in that setting, it can be hard to remember that. So talking about it beforehand, like calling, letting them know, putting it down, telling someone, and communicating with your case manager and your staff to try to, what can make this easier for you. And then scheduling based on your tolerance, you're a boarding person and you want to just get this done, great. Or a 2 p.m. appointment is gonna like weigh on your brain all day long. You're not gonna be able to do anything else. Okay, like let's see if there's something earlier. And also talking to your dentist about like pacing of your appointments. Can you do more? Can you just do more in one appointment? Or if you're someone who needs more breaks, can we do a filling and then a filling? Like it might not be possible, but kind of coming up with those things that could be helpful. And again, communicating, asking, consulting, and seeing what's possible. We encourage folks to bring along a support person, family, friends, their case manager, sometimes me. Sometimes I go back while someone's in the chair, sometimes they sit in the waiting room. It can just make a difference to have just someone there. Often what I'm doing when I'm there is like reminding the person that like, oh, remember, like you said that this is helpful to you. Like, did you tell the dentist that yet? That sort of thing. We encourage folks to bring distractions, bring your fidgets, bring your stuffy, bring your AirPods, whatever it is that you need to like stay through the appointment. A distraction can be really awesome. And then we get into like the bottom 3 on here are more of the, like, these are things that are gonna take either, they're gonna cost something or more coordination, or not all clinics do this, or like sedation to get fillings. That really isn't a thing that is offered. So like let's, a lot of times, the reason I have these on here is folks will jump right to that. Like, I can't go to the dentist unless they knock me out to do all of my cleanings and whatever. We're like, well that, I don't know, there's maybe commercials on TV for that, but they don't take MA, and that's for sure. So like, what else can we do that isn't that? What's easier, higher up on the chain? I think this was in here from a different presentation, but again, another conversation we're having is people will wait till they're in pain, and by the time you have pain, that's an indication that something is very not right in here, in your mouth. So I have the toolkit that I wrote. I was just gonna pull it up, but then my password is whatever. It's available. It's on the MOHC website. And my biggest hope for it is that is first of all, like, dentists are doing amazing work. You are awesome. People in this profession, and then helping the folks that we serve. I hear great stories all the time. I hear amazing things alongside some challenging stories, but I think there is, my understanding is like the dentist who said to me, like, I'm glad you're here today. I get that sense from most dental providers. They're glad to have folks there. And sometimes the things that can be helpful are small, just shifts in whether it's in like a process or that greeting at a reception desk, you know, that person who's like, they're so kind to me every time I go in, I want to keep going back to that appointment. And that, you know, it's nothing, I don't think anything that I wrote in this toolkit is like earth-shatteringly like new information, but a lot of it is just kind of pausing, maybe slowing down, asking some different questions. And in there, the last like end of it, there's a lot more information about the those frameworks like motivational interviewing, person-centered care, and trauma-informed care. And then there's a section where I kind of brainstormed with folks about different places within the dental clinic. So when you walk in the front door, like who are the people you're seeing, and what could be, what might be helpful to folks to have an easier time going through that appointment. Again, there's nothing huge. It's all really small, and maybe things you're already doing. And it just, I want people to know that it makes a difference. When I tell people that I work in the mental health field and I help people go to the dentist, a lot of times they hear like, oh, yeah, that's because people with mental illness like don't care about their teeth, or that's because, you know, whatever. And I always have to correct the folks that I work with every day absolutely care about their teeth. They absolutely care about their oral health. There's a ton of other things going on in their lives. And so approaching, you know, knowing that that's kind of the dominant narrative that exists out there, you know, approaching from like, I'm so glad you're here because I know you care about your health. I'm so glad, like, what can we do? How can we work together on this? So yeah, again, nothing too huge, but some, you know, hopefully helpful. And thank you for all of the work you do, because it makes a huge difference for everybody. So I don't know how much time is left, but I can jump to questions. I feel like I just talked a lot. I did. I guess that's what we're here for. But what questions do folks have?
I do have a question.
Yeah.
So you said that you recently started some case management with children.
Yes.
Specific, I'm assuming mostly with like ASD and ADHD, or is there some?
There's two. It's ASD is one of. There's two qualifying diagnoses.
Okay.
ASD is one.
Okay.
Yeah.
Have you found anything, just because I work with the families, especially coaching to just like the basics with kids, and I have health educators that work with their families.
Yeah.
Is there something that you, other than the things that we're used to, like other than it's just a huge sensory overload to go to the dentist, that you find you getting feedback from the parents and the families that would be good to know to share to help like overcome some of that anxiety and get those better oral health outcomes for them?
I think one thing that is more recent, and maybe this is already part of it, is like doing the social stories.
Okay.
So knowing what to expect.
Okay.
You walk, so social stories, if you're not familiar, it's like, I've seen websites, I wish I could remember, but
We
like,
have our app.
Oh,
Yeah,
yeah,
here's what
there's
our front desk's like. Here's
Yes.
what the chair looks like. Here's what's going in your mouth.
it's so awesome and so helpful, even for as an adult, where I'm like, who do I have to talk to first? Like, which room, what door do I go into? So social stories, and then something we're recently, we just got a new clinical supervisor for our children's teams, and he said, oh, do you do anything like alongside, you know, the person receiving services is the kid, but they're in a family. Like, what about, you know, do we have, they don't like qualify for the things that we can offer the kids, but like, can we give the families information?
Yeah.
Like, can we send them to a clinic that sees all ages? And trying to like give that information, because when the parents are able to go, it makes it way easier for those kids to go too, and then they can have that like, I'm doing this, like, yeah, it is loud and bright, like, and, you know, mom went last week and your appointment's next week, so, yeah, that's
Okay.
thoughts.
I-
Yeah, if there's ever ideas, I also would love to hear that. Sure. Yeah.
We're speaking that, so.
Yeah.
Yeah,
We're
we're
gonna
gonna
take a look at.
Awesome. Any other questions? Thank you for being here. And please reach out to me. I think it's so important to talk about this stuff. And the more that, I mean, obviously we're all in this, like, we're all coalition, so like the more that we have these conversations are together, like, the better things go. So, thank you.